The patient is the 62-year-old male who presented to the emergency room with altered mental status, confusion, and vomiting blood, which looked to have brownish particles within it. He has a 20-year history of alcohol abuse and was recently diagnosed with cirrhosis of the liver 6 months ago. He was brought in by his girlfriend, who stated that he had been consuming up to a bottle of hard liquor a night for the past 6 months. She stated that she found him sitting on the couch confused and altered and was unaware if he had been drinking. He has a past medical history of substance abuse, alcoholism, hypertension, depression, and GERD. Upon physical exam, the abdomen was soft and tender with presence of fluid wave on palpitation, as well as distended veins around the umbilical area of the abdomen. His extremities were negative for edema, and his O2 sats were at 80% upon arrival. His laboratory results showed a blood alcohol level of 0.12%. He had a low phosphorus, albumin, hemoglobin, hematocrit, and platelets, as well as high AST, ALT, bilirubin, serum creatinine, BUN, and serum ammonia. The patient was admitted to the ICU where he was still vomiting blood and had bloody stools. The patient was intubated and had an endoscopy, which showed bleeding esophageal varices. Packed red blood cells and fresh frozen plasma were ordered for the patient. The patient is currently experiencing acute liver damage due to his alcoholism and cirrhosis. The acute liver damage has brought about the esophageal varices, portal hypertension, hepatic encephalopathy, ascites, spontaneous bacterial peritonitis, as well as hepatorenal syndrome. It's recommended to initiate octreotide, lactulose, furosemide, spironolactone, D5W, ceftriaxone, and propranolol, as well as continue the patient's rifaximin treatment. It's also recommended to discontinue his acetaminophen, ibuprofen, normal saline, and metoprolol for the time being.